Welcome to Family Health by Mini First Aid. Mini First Aid are the UK's leading family first aid provider, and we are delighted to bring our latest podcast series to you, giving you all the information that you need around family health subjects. Thanks for joining. Series 1 of Family Health by Mini First Aid podcast is sponsored by Savlon Scar Prevention Gel. Savlon Scar Prevention Gel helps soothe pain, promote faster healing, as well as reducing the risk of scarring when used on minor wounds, superficial burns and grazes. With 6 children in my house, scrapes and cuts are plentiful, so my first aid box saviour is Savlon Scar Prevention Gel. Welcome to our podcast, Family Health by Mini First Aid. It is great to hear that you've enjoying our new Family Health podcast series, where we will continue to bring you some of the top family health advice from our leading experts. So without further ado, I am absolutely delighted to introduce our guest today, Paula Hallam. Paula is a registered specialist paediatric dietitian with over 20 years experience. Welcome to the show, Paula.
Hi, Kate. Thank you so much for having me.
It's a pleasure. And Paula, tell everybody that's listening, all our families that are listening, tell everyone a little bit about yourself and what you do.
Okay, brilliant. Thanks, Kate. So my name's Paula. I have a mum. I am a mum to 2 girls. I have 2 girls, and I am a children's dietitian. As you said, been a dietitian for a very long time, over 20 years now. I trained in Cape Town, South Africa. That's where I grew up, and then shortly afterwards moved to the UK. So almost all my time as a dietitian, I've been working in paediatrics with children and families. It's always been my absolute passion. When I was a student dietitian, I just knew that that's what I wanted to do. So I've worked in lots of different specialties within pediatrics, lots of different hospitals, children's hospitals, for some charities, some food brands. So lots and lots of different things. And most recently, the last sort of 7 years or so, I've been working mainly within food allergies, and was working at an allergy research unit up until very recently, a couple of months ago. And I'm also very, very passionate about plant-based nutrition. That's something I'm really, really interested in, sort of personally and professionally. And I have a freelance business called Tiny Tots Nutrition, and also another platform called Plant-Based Kids. So that's me.
You are a very busy lady.
I like to keep busy.
Today we've invited you to chat to us about food intolerance in particular, and in particular secondary lactose intolerance following a stomach bug. Now, some of you may not have even heard of this before. It certainly wasn't something that I'd heard of. But over the last few months, I've become very familiar with this particular situation after my daughter Olivia developed it. And I was absolutely flabbergasted to discover how common this is, Paula.
Yeah, it's actually really, really common in adults and children after having a stomach bug, like you said, like a gastroenteritis type illness. It's really, really common in both adults and children.
Fascinating. Well, we're going to learn some more as we're chatting today. But I guess the first question that we all want to know really is, if we're focusing on the word intolerance, I think there's a lot of confusion between intolerance and allergy. Can you clear this up for us so that we all understand?
Yeah, sure. Absolutely. So you're absolutely right. There is so much confusion between those sort of terms, intolerance and allergy, and often they can be sort of used interchangeably, but they really, really are very, very different. So when we're thinking about allergies, let's think about that first of all. So allergies are to do with the immune system, and that is when our immune system reacts to a particular food, protein, or if in the case of food allergies, or it could be, something like pollen or cat dander or something like that in terms of other types of allergies. But in terms of foods, it's when our immune system reacts to a food protein. So, for example, a milk protein, and it causes a sort of various symptoms in the body. So normally if someone isn't allergic to, for example, milk, when they drink milk, no symptoms, are absolutely fine. So the immune system kind of has this sort of abnormal reaction to a milk protein, where other people that don't have an allergy would tolerate that particular food protein, no problems. So it's like the immune system sort of recognizes that protein and has a sort of reaction to it. Various chemicals are produced and certain symptoms happen. And in allergies, food allergies, you can get immediate type allergies and delayed type allergies. So the immediate type, as the name sort of suggests, the symptoms come on quite quickly after someone has eaten a particular food. So for example, in the case of milk allergy, cow's milk allergy, if someone has drinks some milk or some kind of eats a food that has got milk protein in it, then they can develop symptoms if they've got that immediate type or IgE mediated, we call it, because the immunoglobulin E antibody is produced. And they can have symptoms quite quickly. So within about a few minutes, 10 minutes, usually that can happen, up to about an hour, but it's usually quite quickly after ingesting that particular food. And they can have the sorts of symptoms they could have are things like skin symptoms, so like a rash that can extend across the whole body, hives, so little like raised bits on the skin. They could have gastrointestinal symptoms like vomiting, diarrhea, and also going back to the skin that can be quite itchy, the rash, and sometimes they can get some swelling like around the lips or the eyes, typically things like that. And then in rare cases, you can get some more severe symptoms affecting the breathing and the airway of a person, and obviously that would be a medical emergency. And then you also get, so those are the immediate type allergies. You also get delayed type of allergies, and I think this particularly is where the confusion comes in with sort of allergies versus intolerances, because the delayed allergies, as the name sort of suggests, the symptoms come on longer after eating a particular food, so typically more than 2 hours, and can actually be sort of the next day or something that someone develops symptoms. And those symptoms can be a little bit more vague and difficult to sort of pinpoint this particular food, so not as easy as immediate type allergies to sort of necessarily pinpoint the particular food that's involved. So the sorts of symptoms that children or adults might develop are also skin symptoms, but tend to be sort of more non-specific rashes, might exacerbate their eczema, and they could have things like changes in bowel habits, diarrhea, constipation, abdominal pain, a colicky type pain in young children. So you can see that those things are sort of quite vague, and they can be related to other illnesses as well, things like reflux, things like that. Those symptoms can also be exacerbated. So it's usually when there's a collection of these symptoms that we might suspect a delayed type allergy in a child. And then with intolerances, you can get some of this sort of similar symptoms to delayed allergies. And I think that's why there's a lot of confusion. But with that, yeah, exactly, with Olivia. So with intolerances, it's actually a digestion issue. So that the problem is around digesting, and particularly with, for example, with lactose intolerance, it's the lactose, which is the sugar in milk, the carbohydrate or the sugar in milk that is not digested properly, and then that can cause symptoms like diarrhea, bloating, abdominal pain, a sort of gurgling noise in the stomach, lots and lots of wind. Babies can sometimes get a nappy rash, things like that. So it's only abdominal, gastrointestinal symptoms. You don't get, sort of a worsening of eczema or skin symptoms or anything else related to it. It's purely gastrointestinal symptoms. So those are the main difference. So it took a long time explaining that, but I think it's really important to sort of differentiate between them. Intolerance, like lactose intolerance, it's the sugar in milk, and with immune system, the allergies are related to the immune system, and it's the protein that's involved.
Right, that's fascinating, because I think, I noticed with Olivia that I perhaps was banding around the wrong terms, and I was saying that it was an allergy and then perhaps it was an intolerance. But actually, it's quite interesting with some of the things that you say about delayed allergy, because she has had skin issues as a result. So that's quite interesting. Lots of food for thought for me. But what are the most common foods that children might be intolerant to, and why are intolerances becoming more prevalent?
Sure. So I think, well, the main foods is milk is one of the main ones, like we discussed, and particularly after a bout of gastroenteritis, a tummy bug, we typically call it. And I know obviously we're going to talk a bit more about exactly what lactose intolerance is a bit later. But yeah, milk is a very common one. Sometimes some children and adults can have problems with wheat, and it might be that they're sensitive to gluten, or it might be the carbohydrates in bread, for example, that some people don't digest quite so well, and some people tend to develop a sort of irritable bowel syndrome type of symptoms, which basically, as the name suggests, a sort of gut-related symptoms. So changes in your bowel habits, abdominal pain, diarrhea, constipation, things like that related to gastrointestinal symptoms. So wheat and milk tend to be the most common. Sometimes some children can have contact reactions to certain like fruits and vegetables that have high contents of histamine. So children, particularly babies, have got very sensitive skin, but particularly if they've got eczema or some other skin condition, they have got very, very sensitive skin. And sometimes if the food, when they're eating, the food often gets everywhere. If it touches, it touches the skin, that can have a sort of localized contact reaction in that particular area where the food has gone, and sometimes on their little hands, if they, obviously they're picking up the food and things, and that can cause a little bit of redness and a sort of rash. But that sort of rash doesn't tend to extend onto other parts of the body. It's a sort of very localized rash that they can get.
So these intolerances,
so I appreciate it's quite confusing for parents, It
is, because these things. I guess you're thinking, is that an allergic reaction or is that an intolerance? So I guess when we talk at our classes, we talk about monitoring and keeping a diary. Yeah. I'm also really interested in why it seems that intolerants are becoming more prevalent. There is people talking about it all the time, about not being able to, or taking certain foods out of their diet because of an intolerance. Why is that? Why is that happening?
I'm not too sure I have the answer to that. It's I think there is much more of an awareness, definitely. And I mean, certainly in adults, things like irritable bowel syndrome, I think we're understanding a lot more about that than we used to, and that it is becoming more. There is becoming more awareness and understanding in that particular condition. But what you said about keeping a sort of food symptom diary, I think that's so important, because sometimes things can just randomly make you feel not that great on that particular day or something. But I think it's important to, if you keep a food and symptom diary, you can really sort of spot patterns that are maybe happening there. And what we're looking for is if, something each time you eat it, or each time you eat a certain quantity of it, it is giving certain symptoms. And I know not everyone has access to a dietitian that easily, but you can ask your GP to refer you to a dietitian, and a dietitian can really help you sort of go through something like a food and symptom diary to try to see if there are any patterns that are emerging from that.
So that's interesting what you said about having access to a dietitian. Is it easy to access help and support then if you suspect that your child or somebody in your family has an intolerance?
Yeah, I think, well, the first thing to do is speak to your GP. Definitely, first port of call. If it's for a young child, speaking to a health visitor can be very helpful as your sort of initial first port of call. I think it varies a lot around the country in terms of how quickly you can access a dietitian, for example. So I think everyone can ask their GP to refer them or their child to a dietitian, absolutely. And then I think the local services, it just depends on how long that might take. But I think particularly with children, and if as a parent, if you're concerned about your child's growth or things like that, it's really important to speak to your GP and explain your worries, your concerns, and then they can help speed up that process as quickly as possible.
So, what tips then have you got for families like ours, where somebody in the household is living with a food intolerance? What would be your best advice? What do we need to be doing?
Yeah, sure. Well, I think trying to get some support. That's really, really important, because these things are usually not straightforward. It's helpful having someone that you can speak to, that you can ask questions, bounce ideas off. Why did this happen? How can we do? Accessing that sort of help and support and guidance. I think that's really, really important to try and get as much support as you can. And yeah, I think that is really the main tip that I would have for families.
Yeah, it's getting that help and having somebody to clarify. I think
definitely.
This worry that I think when you talked about the differences at the beginning, where we talked about the differences between an allergy and an intolerance, and that in fact, I guess chemically in your body, that's two different reactions, isn't it? Is the fear as a parent or carer that you're going to give your child something that actually could do them some real harm? Because I guess that's the sort of more of the allergy side of stuff. And having that, it's that unknown factor, isn't it? As to whether actually if I give them something. I also found that I needed to look very closely at labelling for what ingredients were.
Definitely.
It was quite surprising the amount of things that contained things that we were intolerant to. It was just like, it blew my brain.
Reading labels, that is a real skill as well, and it's time consuming. So I think it's getting your head around those things that you may not have thought about before. And there's some foods that you might be surprised. I'm sure you were of things that contain lactose, or sort of and also there's some non-food things, like some medicines can contain lactose. And certain things like toothpaste, vitamin and mineral supplements, weird things like that you wouldn't necessarily think of as having lactose. So absolutely, that's food labeling. I think that's a huge area. And I was just going to say, Kate, that I think it's really, really important, just sort of to add to the thing about seeking support, because one of the things which totally understandably happens is that people can start sort of eliminating lots of foods that they think may be related to the intolerance, and understandably, but for children especially, you can run into problems with them developing nutritional deficiencies and things. And so I think that's where accessing a dietitian can really be helpful, looking at that food and symptom diary and trying to work out what it is that is causing, or may be causing, those problems, so that you don't eliminate too many foods, which can make things sort of nutritionally unbalanced.
Okay, that's really interesting. Now, I obviously invited you here for all of our listeners to understand about the differences between allergy and intolerance, and particularly intolerance today. But I have very selfishly invited you on as well, because I want to talk to you about secondary lactose intolerance. I had never, ever, and was a mum of 6, you'd think I'd have heard of everything by now with ailments with children, but I had never heard about it until 6 months ago. And now I find out it's really common. So I know we've touched on it at the very beginning of our conversation today, but tell our families listening what might cause a secondary lactose intolerance.
Yeah, sure, of course. So, what happens when, or what can happen when a child or an adult has a stomach bug? So, gastroenteritis might be caused by a virus or bacteria, but essentially, if you have diarrhea and your gut is a bit damaged by that virus or bacteria that you have, that can cause problems. And the reason for that is that the gut is made up of these little villi, which are like little fingers, and they've got all sorts of enzymes which help us break down and absorb food, sort of along those fingers. And when you have an illness, they can that can cause a damage to the gut lining, and these sort of fingers can get kind of damaged, and they essentially are kind of flattened. And the lactase enzyme, which is the enzyme that breaks down lactose. So enzymes are like little sort of scissors in the body that sort of break various chemicals down into smaller parts that can be absorbed by the body. So lactose, the sugar in milk, needs the lactase enzyme to help our bodies break that down into smaller parts, which are then absorbed by the body. But if these little fingers, these little villi, have been damaged and flattened, then the lactase enzyme, which normally sits sort of in those fingers, that has been sort of either decreased or taken away completely. And so that means that lactose, which normally is broken down in the small intestine, so after your stomach, there's the small intestine. So normally lactose is broken down there and absorbed. The sugars, glucose and galactose that it's broken down to, are absorbed into the body and used for energy and various other processes in the body. But if that lactase enzyme isn't there or is very, very decreased, that means that the lactose can travel through the gut, so through the small intestine and to the large bowel or the colon. And in the colon, we have trillions and trillions of bacteria, and the bacteria can ferment or sort of use up the lactose as a food for them, and that produces gas, produces various symptoms, brings in water into the bowel, which means that you get this diarrhea, and so that is why you can get these symptoms of like pain, bloating from the sort of the gas that these bacteria are producing. So bacteria in the gut, in the colon, is a good thing. It's not a bad thing. It's just when the lactose sort of reaches the large bowel at the end of our bowel, the colon, and starts breaking it down, it can cause, that's when these gases and things can be released, and that can cause bloating and some pain and diarrhea that you can experience with lactose intolerance.
How then do you know that a secondary intolerance has occurred following an illness and it's just not the illness continuing? Because that's where we were very mixed for a while. We didn't realise that the bug had probably gone, and that Olivia had then got this secondary intolerance, which then meant that she was having this reaction to the lactose. How do you know?
Well, it's a really good question, and I think it's really difficult because obviously the initial illness from the virus or bacteria has caused this, diarrhea and maybe vomiting, things like that. And then, as you said, you think it's just sort of continued. And I think the main thing is with, when you're ill initially, and I'm sure, Olivia, you go off your food, you don't want to eat anything, and just sort of getting in sips of water or rehydration fluid is the main priority. But then after a few days or a week, you'd expect someone to be starting to maybe try little bits of food again. And I think it's that at that point when you sort of start trying to reintroduce your food again, and particularly things that have got milk in them, and then these symptoms sort of carry on or come back, that's kind of the clue that it's sort of continuing. But it's tricky, and it actually brings up another thing that isn't a specific test as such. So when we're talking about the difference between sort of allergies and intolerances, I think another really difficult thing for parents is that there isn't a definitive sort of test for intolerances and delayed allergies, actually. So for those immediate type allergies that I was talking about, it's much easier to recognize, first of all, because the symptoms happen quickly afterwards. And also there is that we have got tests. There's a blood test or a skin prick test which can test for those IgE antibodies to specific foods, and that the tests, along with the history, the clinical history of the child, can help us sort of piece together the puzzle that yes, this looks like it is an allergy. But with delayed allergies and with intolerances, actually, that the main test is to eliminate the suspected food for a period of a number of weeks, see if the symptoms improve, and then reintroduce it and see if those symptoms do come back. So I think the difficulty for parents, and I totally empathize with this, is that it really can take a long time to try and see if, to sort of test that theory. And so, it isn't easy.
It was actually chance from Google. And we always say to parents who come on our classes, don't Google ailments.
Don't use Google.
I didn't take my own advice. And I looked up and it actually came up in the search term. And actually I spoke to our GP who confirmed that, from what information I'd given at that point where she'd been poorly for a period of time and then was better. Yeah. Then we'd pretty much reintroduced a normal diet, but then we started seeing this sickness and tummy pain and diarrhea and what have you. So actually that was our diagnosis. It was the reintroduction bit that we just weren't sure what to do. Yeah, I think that bit is really difficult for parents. And again, I really, really empathize, because especially you've had a period of time where you're sort of eliminating the suspected food and your child has really got a lot better. And, it's like, great, things are going so well. And then that reintroduction bit is so important to confirm what we suspect, but it's a difficult thing to do, because then you're essentially giving your child those symptoms again to confirm things. And so I think it's not an easy thing to do. And we sort of touched on it a little bit earlier, but in terms of delayed allergies and lactose intolerance, for example, so delayed milk allergy and lactose intolerance, just wanted to give those as examples that a lot of the symptoms, I said, there can be a bit of an overlap, and really frustratingly, delayed milk allergy used to be called cow's milk protein intolerance. So there's many years ago, like sort of 20 years ago. So there's still, and I still hear it even by some pediatricians saying that. And so that can cause huge confusion, of course. But I think the main thing with the sort of trying to differentiate is that, first of all, with lactose intolerance, you shouldn't get any skin symptoms. If you do, obviously speak to your GP, but there shouldn't be any skin symptoms. And also you can try, in terms of the elimination period, you can use things that are products that are lactose free. So like a lacto-free milk, and lactose-free cheese. But those products still contain the cow's milk protein. Right. So if you try, for example, like a soya milk or something like that, which doesn't have lactose in it, but it also doesn't have the cow's milk protein in it, that can sort of complicate things. So with lactose intolerance, it's a good idea to try the products that are lactose free but still contain the cow's milk protein. So we can try and see, if it's that specific. The lactose specifically, and not the cow's milk protein that's causing the symptoms. I've been very impressed with the lactose-free products in taste.
They're good, aren't they?
In spotting the difference. Because when you're feeding a family, and I guess you would like everybody to eat the same. So actually, what we did is we introduced using lactose-free milk in our cooking and everybody had the same, and nobody noticed. It was great. It was great. Let's all have and that also helped, because I think there's also a thing, I'm sure adults, I know I've got friends with intolerances feel it as well, but I think particularly for children, it's that feeling of difference, isn't it? I'm not allowed this. I have to wear a lanyard at school that says I can't have certain things to eat.
Which is all sort of negative connotations, isn't it? You want that inclusive nature of things. Yeah, you want everyone to feel included in the family meal.
So just with this secondary lactose intolerance, do children grow out of it? Can you slowly reintroduce lactose into diet? How does it work? Or is that it now? Are we a lactose intolerant individual because we've had this secondary lactose intolerance?
Yeah. So yes, absolutely. They do grow out of it, as in the gut heals. So what I was saying in the beginning, when I was talking about lactose intolerance, that what happens when you have an illness, that those villi, that the gut is damaged, those sort of grow back over a period of time, and the gut heals. So usually over about 6 to 8 weeks. That's usually the sort of time period where we would expect that healing to happen, and then those sort of villi should have kind of grown back, and meaning that the lactase enzyme would be there again, and they should be able to start digesting and absorbing the lactose again. That actually makes me think of something else as well. I'm not sure if you found this with Olivia, but with lactose intolerance, there's usually a sort of level that they can tolerate. So sometimes during the initial period, I think it is a good idea to try and eliminate it as much as possible. But at a point where you've sort of stabilized, there might be a little bit of lactose that they can tolerate, because there might be little bits of that enzyme still around, but just not as much as there usually is. And so sometimes people are able to tolerate little bits of foods that contain lactose. Whereas with an allergy, for example, generally speaking, you would have to avoid completely the food, the cow's milk protein, for example. So many people can tolerate a certain amount. Just wanted to also say that if something persists, obviously beyond 8 weeks, obviously speak to your GP about that. Check it out. There are certain conditions, underlying conditions, that can present with lactose intolerance. So, obviously for Olivia, it was quite a clear history, because there was a history of that sort of gastrointestinal symptom illness, and then the lactose intolerance after that. But sometimes, if things carry on or just doesn't seem to be improving, always speak to GP. Celiac disease can present as lactose intolerance. So because celiac disease is there is a sort of underlying damage to the gut lining that can also present as lactose intolerance. So if things are sort of carrying on for longer than expected, so I would say longer than 8 weeks, definitely speak to your GP, get that checked out, just to make sure that there isn't anything else going on with the gut.
Thank you. It's fascinating. I think it's all absolutely fascinating. This is all a new chapter for us in learning about intolerances. Paula, thank you so much. I know we've chatted before in previous times with Mini First Aid, and we really value your input, especially on information on both allergies and intolerances. And thank you for those insights today. Is there, as a final question really, is there anything in particular that you would want families to take away from what we've discussed?
I think that the main thing is that to understand that there is a difference. Allergies and intolerances are different. And also, I just wanted to say that doesn't mean that intolerances are sort of, not as severe or whatever as allergies. They might not be life-threatening, but, they can still cause significant symptoms and significant decrease in a person's quality of life. So I don't think we should ever sort of underestimate how things can affect people and their lives. And you don't want to be, I would never want people to sort of feel that it's sort of just an intolerance. It's of course not necessarily life-threatening, but can cause, significant quality of life differences. So I would say that's the main thing. And, just speak to someone if you're worried about any symptoms in your child or yourself.
Paula, thank you. Thank you so much for all the advice that you've shared with us today.
Oh, it's my pleasure. Thank you so much for having me.
Oh, brilliant. Well, please do subscribe to our podcast and our social channels to keep up to date on the latest episodes of Family Health by Mini First Aid. And also, if you would like to watch the full video of Paula and I chatting to each other today, if you go over to the YouTube channel Family Health by Mini First Aid, you can watch the podcast in full, as well as listen on all your usual favourite podcast spaces. If there are any topics in the future that you would like Family Health to uncover and learn more about, please do get in touch. We would love to hear from you so that we can invite more guests like Paula to come and share their expertise with us. So Paula, thank you again for joining us, and thank you everybody for listening. Thank you for listening to Family Health by Mini First Aid. I hope you found our podcast really useful and informative. If you want to know more about Mini First Aid classes, courses, qualification courses or first aid supplies, please do visit minifirstaid.co.uk or look us up on all your favourite social platforms at Mini First Aid. I take Savlon Scar Prevention Gel everywhere with me so that I'm always prepared for the many little and sometimes bigger accidents that my kids encounter. Thank you again to Savlon Prevention Gel for sponsoring Series 1 of the Family Health by Mini First Aid podcast.